Welcome back to the Afro Mosaic Health Guide. Today, we're going to break down the public health crisis that erupted in Jamaica after Hurricane Melissa, a Category 5 storm, hit in late October. We're drawing on WHO and WHO alerts, CDC guidance, and some local intelligence reports.
And our mission here is really to help you see beyond the initial headlines about the storm itself. We want to show you how a natural disaster like this kicks off what experts call a deadly second disaster.
Post-second disaster.
Exactly. It's a crisis of systemic collapse. Going to focus on the twin threats of waterborne diseases like leptospirosis and then the looming danger of dengue fever. And all this is happening while the healthcare system is just crippled.
So let's start there with the immediate aftermath. The scale of the infrastructure failure was staggering. We're talking catastrophic flooding, landslides, and then the loss of care. 75 primary care facilities were reported inoperable.
75. And on top of that, 5 major hospitals sustained significant damage. It's so critical to understand what that actually means. I mean, when a health system fails, mortality skyrockets. Some research shows that the death toll after a hurricane can be up to 300 times the direct number of deaths from the storm itself.
300 times. So the storm is really just the trigger.
It is. The real killer is the systemic breakdown that follows.
So what was the most immediate, deadly part of that failure?
Well, it's the complexity of it all. Saw the cold chain get compromised almost immediately.
And that means things like insulin and vaccines.
Exactly. All those temperature-sensitive drugs were put at risk. Then you had reports confirming that emergency response was slow, and just getting common medications was incredibly difficult. For anyone with a chronic condition, that's basically a silent death sentence.
And that breakdown didn't just affect chronic care. It created a vacuum for infectious diseases to just rush in. The most urgent crisis right now is the declared leptospirosis outbreak. As of late November, it's across 8 parishes.
That's right. We're looking at 9 to 11 confirmed cases, about 28 suspected, and tragically, 6 suspected deaths already.
And how does that spread so fast?
It's a textbook post-flood killer. It spreads through contaminated floodwater, often from rodent urine coming into contact with people. But the real danger, especially when you can't get to a clinic, is how it presents. The initial symptoms, fever, headache, muscle aches, they just look like the common flu.
Oh, so people might wait to seek help.
And that delay can be lethal.
And while they're scrambling to manage that bacterial crisis, they're already looking ahead to the next wave. There's a high-risk forecast for a major dengue outbreak.
Yes, because all that standing water left by the hurricane is the perfect breeding ground for the Aedes aegypti mosquito. The surge is predicted for early 2026.
And that's on top of their regular flu season.
Precisely. Jamaica's flu season starts in October-November, so the public health system is trying to track seasonal flu, dengue, and leptospirosis all at once. It requires this, massive, integrated surveillance effort.
Enjoyed this information? Give the post a like and subscribe to the channel to stay updated with the latest health tips.
Your support helps the channel thrive and enables us to bring you more valuable health updates.
So what's the international community doing?
Well, they're moving. PA and the WHO have appealed for $14.2 million for a 6-month plan. That includes things like diagnostic kits for leptospirosis, enough for about 4,000 samples, and support for tracking respiratory viruses, like influenza and SARS-CoV-2.
And I saw this fascinating local solution being deployed. The water step bleach makers.
Oh, those are incredible. Great example of local innovation.
They produce medical-grade disinfectant right on site just using water, salt, and electricity.
Which is absolutely vital for sanitation when supply chains are completely broken.
So, if we pull this all together, what's the key takeaway for you, our listener?
I think the main lesson is that disaster resilience can't be siloed. You need to be able to track all these different threats, respiratory, waterborne at the same time, especially when your infrastructure is down. Your ability to detect and treat is only as strong as the road to the hospital, you know?
It really makes you think about the silent toll of these disasters. It's not just the wind damage, but the interruption of that long-term chronic care. And it leaves you with a final thought. How might our disaster policies change if restoring access to critical medications, like insulin, was treated with the same urgency as restoring the power grid? It's a question of prioritizing saving systems, not just counting the wreckage.